The Wellness Revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to the program today. I'm going to talk today about the relationship between anxiety attacks and female hormone imbalances. Now, historically, going all the way back to Greek times, women who had anxiety problems were called hysterics. They had hysteria. Hysteria comes from the root word hyster, which is in Greek means uterus. And the Greeks attached to women who had anxiety attacks, panic attacks, and act crazy at times, certain times of the month. They called it hysteria, which literally means in Greek a wandering uterus. They knew somehow that women's emotional stability was somehow related to hormones and to their menstrual cycle. And you probably realize this in your own life if you've had any problems with premenstrual symptoms, mood swings, fluid retention, weight gain, breast tenderness, headaches that occur premenstrually, maybe a few days to a week or even 2 weeks before. You notice that happens once you have your period, then everything settles down and you feel normal again. And this is now, and so it's associated with a host of problems for which women seek care from their physicians. And no longer do we necessarily call it hysteria, although people can have hysterical attacks, but it's the physicians started testing blood. When they started to test blood, they found, well, everything looked normal. So they tell a lady, everything seems to be fine here. We just think you're depressed. And the doctors talk with one another and say, I think they're just basically hypochondriacs. Now, when I was in medical school, and this dates back to 1973 at the University of Texas, the dean of our school gave us a lecture on physical diagnosis, and he said, if any woman in midlife ever comes and has more than one complaint, when you review her symptoms, other goes, I have headaches, I've got breast tenderness, and I feel, I'm depressed, and I get mood swings, and I ache, and I got if they have more than one symptom, he said they are a hypochondriac and need to be placed on antidepressants. Well, that is ridiculous because nobody has any symptoms in their life because they have low levels of antidepressant drugs by the pharmaceutical company. So that really struck me. And these poor ladies were categorized as hypochondriacs by these doctors. Back then, 95% of the individuals in medical school were males, and that's the way the male profession had looked upon women for literally thousands of years. They knew they had certain emotional problems, and they just said they're hypochondriacs or they're hysterics. We'll just put them on a bunch of drugs once they came up with drugs. Back in the old days, no telling what they did. They put them in insane asylums. They put them into nursing homes. Even they burn them as witches at the stake when they had these problems. Oh, they're a bunch of witches. So what we found, though, is that women's problems, if the women's problems occur premenstrually before they have their menstrual cycle, and the menstrual cycles are governed by what? Your hormones, and there are two main hormones that women secrete from their ovaries during their menstrual cycle. In a perfect world, you have a 28-day cycle. The first half of your cycle, or all through your cycle, you make estrogen hormones, estriol, estrone, and estradiol, and they proliferate the inner lining of the womb. You ovulate mid-cycle at day 14, 15, and there your ovary starts making from the corpus luteum, where the egg came from, it starts to make progesterone. That balances out and it matures the inner lining of the womb, the tissue that's built up, and it gives you balance. Well, what happens is women march through their menstrual life. It can happen early in their menstrual life. It can happen just at puberty. It can happen after childbirth. But by the time a woman hits her late 30s, early 40s, her ovaries don't function as well as they used to. She doesn't ovulate every month, so she's making estrogen the whole time and doesn't have any balance with progesterone. So she gets heavy periods, cramping, and this causes the mood swings, the fluid retention, the weight gain, the breast tenderness, the headaches. All these are a symptom of hormonal imbalance. So rather than placing a woman on antidepressants, anti-anxiety medication, sleep medication, anti-inflammatory medication, all these antidotes, all these drugs, which are all toxic in and of themselves, instead of doing that, what a woman ought to be given is natural progesterone starting day 15 through day 28. So I learned that from Dr. John Lee way back in the 1990s. I read his book, talked to him on the phone, read his book, and began to give individuals, our guests, our women, progesterone. And my gosh, it was like a godsend. It completely cleared up all these premenstrual symptoms. They felt great, and it helped them. It helped their thyroid function. Then I learned about thyroid. I had already been doing thyroid, and then I learned the relationship between the progesterone and the thyroid. The progesterone enables the body to better assimilate thyroid hormone, which governs your metabolism. So the use of progesterone in menopausal women, and even in menopausal women, we still use progesterone and balance it out with some natural estrogen. And that with thyroid has given women a tremendous sense of well-being and health, and really helped with these episodes, which you may have experienced, of sometimes you get panicky or anxious for no apparent reason. And if you think back and relate that to your menstrual cycle, it more than likely is related to your premenstrual symptoms, and then it resolves. Taking a little bit of progesterone, day 15 through 28 of your menstrual cycle, day 1 being the first day of your period. So day 14, you start on day 15, and you take that through the 28th day, and that will, on the right dose, and we have to titrate the dose. Everybody's different. We base the dose on the size, symptoms, and on your size, and basically your size, symptom, and your age. That's how we determine what dose we're going to do. We've given it to tens of thousands of women, so we have a good feel for what dose usually works in women with certain symptoms, certain age, certain size. That's how we handle the progesterone and dosing it. Although we get blood tests don't tell you what level of you need to give. And besides, I've done blood tests from 2 different labs on the same person and got 50% different readings. We use our clinical judgment here at the Hotze Health and Wellness Center to determine at what level you need to be on. And when you get on the right level, you're going to go, I love you, Doc. I feel like $1 billion. So for any of you that are experiencing anxiety attacks, panic attacks, you end up going I know men that have had to take their wives, they thought they're dying, they get palpitations, and they get flushing, and they feel like their throat's closing up, and they take them to the emergency room, and they can't find anything wrong with them. They give them some shot to calm them down, send them home. They come back the next month. I used to do emergency room work, and I used to see some women that would come in every month, and the doctor had a certain injection ordered. Every month they'd come in for that shot, and it may have been because they had migraine headaches, all related to their symptoms. So if you have migraines, let me tell you what, in their premenstrual, let me tell you what, progesterone can resolve your migraine headaches. Magnesium can too. So anyway, if you're having any symptoms of anxiety attacks, panic attacks, and your doctor's told you, oh, everything's normal, you just need to be on a bunch of psychotropic drugs, walk away as fast as you can. Give us a call here at the Hotze Health and Wellness Center at the number on the screen, 281-698-8698, and visit with one of our new guest consultants. Tell them what your problem is, and we'll be glad to get you in and partner with you to get you on a path of health and wellness naturally. Additionally, you can ask them to send you this book, Hormones, Health, and Happiness. We'll be glad to send it to you. This discusses the very things I've talked about in our 8-point treatment program that we have here at the Hotze Health and Wellness Center to help get you on a path of health and wellness. So give us a call. We'd be glad to send you a book free of charge and get you on a path of health and wellness. Thanks so much for joining us today. I'm Dr. Hotze. Look forward to seeing you again soon.
Physician's Preference Pharmacy is a compounding pharmacy specializing in custom-made prescriptions made especially for you right here on site in our compounding lab. Compounded medications offer a unique solution because you're not one size fits all, and we believe that your medication shouldn't be either. You may require a dose to be made that is not commercially available, or you might even be allergic to an inactive ingredient in a medication, which may present a barrier to treatment for you and requires it to be made without that bothersome ingredient. Your body has unique needs, which means that you deserve a customized approach. So if your medications aren't helping you feel your absolute best, then consider speaking with your doctor about having your medications compounded today.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.